this is the part that's really good news and shocking all at the same time, because despite our, large disparities, despite the fact that we have the highest incidence of maternal mortality of the developed countries, the CDC has stated that 66% of these deaths are preventable. And I don't know if that's something we should be happy about or something that we should be ashamed of, because if we could prevent 66% of the deaths, then why aren't we? Why isn't something being done? And so the CDC has stated that we need to start instituting multiple strategies in order to identify and then correct the areas that need correction. They have recommended, and there currently are what they call maternal mortality review boards, where each and every maternal death is reviewed to look for the problem and to look for solutions. They've also advocated basically establishing things like best practices in certain clinical settings so that we can prevent these maternal deaths. And so these are all areas that need to be investigated. And there are lots of people currently working on this problem. What I really want to do today is provide food for thought. I don't have the answers, but I do have a hypothesis about Black maternal mortality. And I believe that this hypothesis is applicable to other women. But as stated before, really am focusing on Black maternal mortality because of this large disparity. And I believe that with this hypothesis that we can see that there is action that can be taken on the individual level, among professionals, and with our government. So it's a puzzle. It's a puzzle, and we all agree that it's complicated, and we're trying to find answers. Couple of things that we do know. We do know that there's an elevated rate of Black maternal mortality. When they looked at the primary causes, it appeared to be related to cardiovascular disease. Now, this is for Black women, slightly different for others, but for Black women, it seemed to be primarily cardiovascular disease, whether it was preeclampsia or elevated blood pressure that develops during the pregnancy, or chronic hypertension, which may have preceded the pregnancy. Cardiovascular disease seemed to be a significant factor. One of the other things which was identified as being a significant factor for African-American Black women was obesity. And so just in terms of medicine in general, we know that obesity is a factor in cardiovascular disease, which could be a reason for the increase in maternal mortality. But then the question is obesity the cause, or is obesity the symptom of yet another problem? And my hypothesis today is that obesity is the symptom of yet another underlying problem. And actually, there are two problems. One is chemicals called endocrine disruptive chemicals, and the other is ultra processed foods. And I am suggesting that this is the basis for our problems. And if we could correct these two areas, then we could impact obesity and potentially lower the risk for maternal mortality. So starting with endocrine disruptive chemicals. Endocrine disruptive chemicals are used in the production of plastics. These chemicals help to change the properties of the plastic, the appearance of the plastic, and these chemicals are everywhere. I mean, it's almost frightening when you see the prevalence of these EDCs, chemicals in our environment. And the question is, how did this happen? How did we get to this point? And this is just a busy slide showing you that there are all different types of EDCs, endocrine disruptive chemicals. They're in our food preparations, they're in our pharmaceuticals, they're in our food packaging, they're in our clothing, they are everywhere. And this little box in the corner shows you the main primary manufacturers of chemicals. Now, why are these chemicals even a problem? By their name, endocrine disruptive chemicals means that they can act like or mimic hormones in our bodies. And as a result of that, they have the potential of disrupting, interfering, altering hormonal regulation. And we're talking about hormones such as estrogen, which is the predominant hormone produced by women. So these are significant. What we know is that unlike pharmaceuticals, which have the FDA oversight to try to ensure that the public is not being exposed to products that can cause harm, with EDCs, a lot of times these chemicals are used in the production of plastics and there's no regulation. And so we don't know the long-term or even the short-term effect of many of these chemicals. And there are many chemicals. Now, how did we get to be so dependent on plastics? Plastic actually is produced from a waste product from the petroleum industry. And it turns out that plastic had two things that were wonderful about it. Plastic was relatively cheap to manufacture, and plastic was versatile. And as plastic became more prominent in our society, beginning again in the second half of the 20th century, we went from a society where things were reusable to a society where things became disposable, meaning that there used to be a milk bottle and the milkman would collect the milk bottle and they would be cleaned or sanitized or whatever, to now we just throw out the milk carton and plastics are used in the production of the milk cartons. It's significant that in 1978, Coca-Cola went from their glass bottles to the plastic bottles. And that was like a turning point. And currently it's estimated that annually 88 billion plastic Coca-Cola bottles are produced. And that's a hard number. That's a hard number to wrap your head around. 88 billion. Someone has said that if you line the bottles up end to end, you could string it to the moon and back 31 times. So that's a lot. And so now we have this throwaway society where we use things one time and then we dispose of it. And we have problems with accumulation, and we have problems with these chemicals that are used to produce the variety of plastics can then leach or get released into our food. We can inhale it, we can swallow it, we can put it on our skin. And the question is, what health risks do they generate? And we're just starting to appreciate that not only is there abundance of plastic in the ocean, in the fish, in the soil, but we also harbor or contain plastics within our body. Just to go on a little bit about this, it's become what they call an invisible danger. We are starting to suspect that these EDCs, these chemicals, can affect children, that they can affect women, and they can affect men in a variety of ways. What we've also have seen, and this is pretty astounding, that 50% of all the plastics were produced, more than 50%, I should say, of all the plastics ever produced have been made since 2000. And it's projected that this number will increase. And so we are swimming in plastics. And now we're seeing that plastics can have the potential to affect our health. And there's the concern that women may actually be at an increased risk for this because obviously we carry the pregnancies, and there has been reports of following women who have a high intake of plastics and looking and seeing elevated levels of plastics in the umbilical cord. We've seen that some of these plastics have been related to other gynecological issues like infertility and fibroid tumors. We know that a number of the feminine hygiene products can contain plastics, which means if they're in our body or opposed to our skin, that they can be introduced into our systems. And probably the most frightening to me is that not only does it have the potential to affect the mother, it has the potential to affect our children, our unborn children. And that's the part where the various medical societies are starting to appreciate that we need to pay more attention to this concern. It has been suggested by the American College of OBGYN that OBGYNs should take the time and discuss and review with their patients environmental hazards, environmental risk factors. But in practicum, what's been seen that only about 45% of OBGYNs have the time or opportunity to talk about the risk of mercury. About 20% will talk to pregnant women about pesticides and insecticides. Maybe 5 to 10% will talk to women about EDC, such as phthalates or BPA, and who knows how many have the opportunity or the information to talk to women about an EDC, which is called an obesogen, and how that could potentially affect women. Part of this is because this information is newly evolving, but who is going to explain this to the OBGYN? And how is the pregnant mother going to know what she needs to do or how she can avoid if it's everywhere? I mean, so these are really huge questions that we need to consider. And even when we are trying to do the right thing, it has been shown that there are what they call microplastics within our plastic water bottles. And that when we buy a bottle of water that's in a plastic container, there is a good likelihood that we are also swallowing microplastics. Now, what's not known is whether these microplastics will just get eliminated from our bodies as they travel through our digestive system, or do they get absorbed into our bloodstream? And if once they're absorbed into our bloodstream, then it's the potential for them to go to various organs in our body. I mean, so this is clearly an area that requires more research, more investigation, more just public awareness.